Hello, hello, welcome back. It's Philippa, and we're moving through menopause. Today, I'm really excited for this conversation that I'm going to be having with Dr. Alan Bauman. Thank you, Dr. Alan Bauman, for coming and joining us today. I'm so excited to talk all about hair.
It's my pleasure to be with you, Philippa. This is going to be
Oh,
great.
well, thank you. Thanks so much. We're going to be learning all about how to keep your hair healthy through menopause, up to menopause and beyond, because menopause is a stage of life that never really ends. So we've got quite a lot of scope there to be talking about hair, and I really appreciate your likes and shares. Please follow the Moving Through Menopause podcast on Apple Podcasts to master the menopause transition. And so, for our topic for today, Dr. Alan Bauman is a world-leading hair restoration surgeon. And so I'm privileged and excited to be having a conversation with him today for on your behalf here on the podcast. So thanks so much for joining us for this episode, Alan. I really can't wait to talk all about hair.
I'm here with you. I'm excited too. So great to be with you.
Okay, thank you so much. So let's really start now with this topic of menopause and the kinds of things that can go wrong with hair. I've kind of had my own experience of, well, definitely of menopause, and feeling like the hair's getting a bit thinner, perhaps. I know what I did personally was I went and had my hair cut. I used to have, like a chin length bob, and it was just sort of hanging there and not doing very much for me. And so I went and had a haircut, and that really helped to liven the hair up. But thinning hair, can be such a demoralizing thing for women. I think, women can be hair can be a real barometer of how we feel in our everyday lives as women. So, what's going on around menopause to our hair when it starts to get thin?
Well, I certainly agree with you. Hair can be a very emotional organ, as we say in the
Mm,
practice here at Bauman Medical. And nearly 45%, almost 50% of our patients are women. But we do see them at
mm,
all ages. So it's not just menopause. Many
mm,
times, women will come in around the time of menopause, being the first time that they've seen hair loss, but they may have had a clue from previous experiences, maybe through childbirth or even with hormone imbalance during
mm,
their childbearing age, or maybe even hair loss in the family. And they already know
mm,
they might be at risk, hoping it's not going to happen to them. But around the time of menopause, as you know, a lot of things are changing, and hair is just one of those outward signs
mm.
that there's hormone changes happening. And so,
Yeah.
what you described, which is very interesting, is something that's very, very common in our female patients, that they notice that all of a sudden their hair doesn't grow to the same length or fullness as it used to.
Mm,
And so, what may have been, shoulder length hair or a thick ponytail, all of a sudden it seems like some of those hair fibers are just not reaching that level of length anymore. And when it comes to hair follicles, we say that's the anagen phase, the growing phase, maybe shortening. And when the anagen phase shortens, in some follicles, you lose that overall ponytail volume. You lose the volume in your hair. You can also see some shedding, excessive shedding that
mm,
occurs. And you can also notice that you have to style your hair differently. Like you might notice that your part line is widening, or that even the temples may be receding or
mm,
thinning to a point where you see more scalp shining through,
yeah.
and that your hair texture changes. So these
Oh,
are all
yeah.
very common symptoms of hair loss as we age. And androgenetic alopecia is what we call female pattern hair loss. And those are all the typical
Mm.
signs and symptoms of androgenetic alopecia. So very often patients will come with those complaints to the practice.
Yeah. So, Andra, what did you call it?
Androgenetic alopecia is the same medical term or diagnosis for male pattern and female pattern hair loss.
Mm,
And basically what it tells us is that there's a genetic component, right? Something that's
mm,
passed along through the family. Oh, my great aunt had some thin hair, or my grandmother also, had hair up to a point and then it seemed to go away. And of course, in male pattern hair loss, we see receding hairlines and bald spots in men. So it looks different in both men and
mm,
women.
mm,
Women can experience a severe degree of female pattern hair loss, but still look like they have quite a bit of hair. And so often they get very, very little respect from their dermatologist in terms of complaining
Mm.
about the situation. And that's why oftentimes they'll come and seek out a hair restoration physician like myself. Um,
Yeah.
and so
Well,
it's a very common thing.
oh, yes. Well, it is, isn't it? And yet, it's not something that we necessarily go talking about, apart from perhaps to our female friends. And you sometimes feel a bit churlish complaining about these kinds of things when, those serious health concerns might bump up to the top of the list. But things like the hair style, feeling good in your skin is so important for women as we are tackling this transition through menopause. So many women are feeling like they're losing their confidence, and for me, the hair really speaks to feeling, confident in your own skin. And so losing that can really take the rug out from under people. Excuse the pun, if there was one there. I think there may have been.
Yeah, be careful
But,
when you talk about rugs and hair
yeah,
loss.
yeah. Sorry. So, but you are so highly qualified because you trained initially as a general surgeon, and so you've really had a very thorough background in all sorts of surgical procedures, and then your chosen specialty was to work in hair restoration. What sort of prompted that decision?
Yeah, so I was never thinking when I entered medical school or even my surgical training that I wanted to be a hair transplant surgeon. In fact, I didn't know really much about hair transplants at all. I probably
Mm,
had most of the standard myths and misconceptions in my mind that it was a pluggy procedure or painful procedure. But what I did know from the time that I was very young is that I was very interested in cosmetic procedures and treatments.
ah,
I liked plastic surgery. My first mentor in surgery was a plastic surgeon in Manhattan, and he took me under his wing, taught me many parts about plastic surgery, not just the techniques and the technologies, but also the procedures that he did and patient care and things such as that. And so I
mm,
was really kind of very motivated because I knew what a great impact cosmetic procedures could have on people's quality of life.
mm,
But it really wasn't until I met a hair transplant patient did I even think about, well, maybe I should, do hair transplant surgery. And in fact, it wasn't a 180 switch right off the bat. I really learned a little bit about hair transplants from a patient
mhm,
who essentially didn't look like he had a hair transplant. So it was kind of exciting and
ah,
interesting to me. He was telling me about how, in our brief conversation about why he went to the surgeon that he went to and a little bit about the procedure that ended up giving him a natural look as opposed to what I thought a hair transplant would look like, pluggy
mm,
and so forth. And but the most amazing thing that I remember about that short conversation was how it changed his life. And so he
mm.
imparted to me the changes both professionally and socially that had happened after he received the confidence and the hair all back after that. And he said his life was never the same. So I figured, well, maybe I should start to look into this as something I could add to my plastic surgery or cosmetic surgery repertoire. That's how I started my journey. So, it went
Mm,
from journal articles to textbooks to actually going to conferences, visiting physicians both nationally and internationally before I,
mm,
felt confident enough to actually engage in a fellowship or program, preceptorship program, and then eventually went down and opened my own practice here in South Florida. And so that was
mm.
over 26 years ago.
Oh,
I opened
my.
my practice and over 33,000 patients ago. So it's been an amazing journey. And what I get to do every single day is help people look good and feel great by restoring and maintaining their own living and growing hair, men and women, all ages. And they look great, they feel great. So that's the fun payoff
Mm,
part of it, is that I
mm,
really get a chance to change people's lives. And so people wonder, why is hair so important?
mm,
And you alluded to this. I think that hair, as you mentioned, is a very strong barometer of our overall health and vitality.
mm.
Evolutionarily, we're programmed in our brain to look for a healthy head of hair, just like we are looking at skin and symmetry.
Oh, okay.
And, if we think back evolutionarily, maybe during the caveman days, you want to be able to judge, is that man or woman across the campfire, a suitable mate to propagate the
Mm,
species. And so you have to
mm,
make some quick judgments, especially if the campfire is not so bright. And one of the things that you see is their full thick head of hair. that they may be of appropriate age and well nourished
Um,
enough to, to
mm,
propagate the species. So I think that that's kind of important. And it's one of the reasons
mm,
why we want to take care of ourselves, our skin and our body, and our hair is a good part of that.
mm.
And when we see
Yeah.
that fading, then we can become depressed. We can become, more concerned about that, and it can really have a huge impact on quality of life. And the research shows that it's
Mm.
important to take care of your hair if you want to have good quality of life.
Well, I mean, I couldn't agree more. And so taking care of your hair, um, what does that look like? Because I mean, we've got all sorts of shampoos on the shelves in the supermarkets, haven't we? Some of which are purporting to have these health benefits, thickening hair, or is it a whole load of hogwash? What are we
Mhm.
talking about?
Well, remember that the follicle is the organ under the skin that produces the hair fiber that we see and we
Mm,
touch and we style and we cut and color and curl and or straighten, to make our hairstyle the way that it is. And so once the hair fiber has been produced, it cannot self-repair. So if you
mm,
mistreat the fiber, essentially you have to wait for another one to grow in order for it to be healthy again, theoretically.
mm,
So
mm,
the things that we use cosmetically are mainly to help deal with the hair fiber itself. Now, that's not to say
mm.
that you shouldn't be putting good ingredients into the shampoo and taking out, ingredients that could be toxic or harmful to your skin, of course. And everybody's skin and scalp is different in terms of their pH and chemistry and
Mm.
microbiome, which is the microorganisms that live on the
Ah,
scalp. And
yes,
our oil
yeah.
production is different, ethnically, and also even as we age, it can change. And
Mm,
so and our activities are different. And so what you might do to your hair with certain style and product and color and things like that might be different than someone else, your next door neighbor or your good friend. And so I take a very keen approach to the health of the scalp, and our hair care
mm,
hygiene, if you will, protocol is important. And so if your scalp is itchy, flaky, oily, you're dry, it's inflamed, your scalp is trying to tell you something. So we should probably listen, is what I've learned. And that's why I've developed an entire department in my practice, basically designed to improve the health of the scalp. And that would be a trichology
mm,
program, run by my in house trichologist and cosmetologist, Kimberly Jenkins, who they call the
mm,
scalp whisperer. She's amazing. Um, so we want to get the scalp healthy, just like if we have a garden and we want to grow good plants or flowers, we want to make sure that
mm,
the scalp is as healthy as it could be. And not everybody has a scalp health issue, but about 50% of folks out there at some point in their life are going to have some kind of dysregulation of scalp health. And so it's important, to consider that. So shampoos and conditioners, not going to be a miracle for hair regrowth, but it's going to help you manage your existing hair better,
mm.
hopefully, and part of that scalp health hygiene program that we want
Yeah.
to, impart to you.
Well, this healthy scalp is fascinating because I mean, if you do have a thick head of hair, you're not really seeing the scalp very much, are you? But it's skin like the rest of the skin on your head, and so I must say I'm kind of guilty of not really doing anything to help my scalp.
Mhm.
I mean, apart from a healthy diet and regular exercise, which probably goes some way to helping. But other specific, well, I know you said that Kimberly's got a whole list of protocols, and it will depend on your individual circumstances. But are there any sort of general tips that you can share for scalp,
Well,
helping us have healthy
I guess
scalps?
Yeah, I guess the most important thing, is your shampoo and conditioner regimen.
Right.
If your
Mm,
scalp feels very, very dry, then you may not necessarily have to shampoo and condition, or shampoo so often, right? Shampoo is taking out the oils and debris and dirt and things like that, or hair product that may have been left behind from your styling. Conditioning re-imparts the moisture to the hair fiber itself, and so there's a delicate balance that needs to be found, not shampooing, showering maybe too often, or not too, not too frequently or not too infrequently, to
yeah.
get that correct balance. Just like your skin, what you use to wash and care for your skin is very, very individualized. And so there's no one size fits all. But for many
Mm,
folks that have thinning hair, you don't want to have, for example, a lot of oil left on your hair, it'll weigh it down. And
Mm.
certainly if you shampoo it out, then you don't want to use a heavy duty conditioner that's again going to weigh it down and disrupt the cosmetic or aesthetic value of the hair.
Yeah, yeah.
And that also goes to the types of things that we do to chemically treat our hair, whether it's a straightening program or curling program or coloring program. If you overdo that, you can definitely break or damage the cuticle, which is that protective coating of the hair fiber.
Mm.
And that's tough. So you want to get to the growing of the good hair. That's really important. So once the scalp is healthy, then we want to take a look holistically at what's going on in your lifestyle habits and think about what are the differences between density or hair caliber in different zones. And so we get into more
Mm.
of a diagnostic protocol here in the practice to try to figure out what exactly is happening if your hair is changing.
Right. Okay. So you've got somebody and they come to you and the hair is changing and they're worried and they want to do something about it. So what kind of testing procedures are would you then go through with this person?
Mhm. Now, we have all kinds of amazing testing capabilities, including hair density measurements, hair caliber measurements, AI powered microscopes, and dermoscopy, as we
Mhm.
say, trichoscopy. But of course, we're going to have a detailed conversation first about what exactly is going on. Is this a sudden shedding that just clogged your drain? Is there some medical issue or medical problem or medication that you just started
Mm.
recently? What have you been doing in terms of your hair care regimen? Have you had any scalp symptoms or things such as that, or health
Mm.
impacts, right? What is your sleep wake cycle? What is your nutrition status? What is your
Mm.
stress level? All of these things can impact the cycling of the hair follicle and the growth, therefore, of the hair fiber, which is what we want to promote, protect, and improve if we can over time. So we take a very I would say holistic approach or functional medicine approach to especially a female patient. Is there hormone
Mm.
imbalance? Should we do
Mm.
some blood work and biomarkers? Are there other things that we need to test? Are you on a special diet? Have you lost any weight? Are you on the skinny shot? Are you on this, a cookie diet? Or what's going on? These are all. Have you had bariatric surgery? Weight loss
Mm.
surgery is still very
Mm.
popular in parts of the world, and so these are things, if you're changing or losing weight, by, let's say 10%, 15% of your body weight, that's going to impact your hair. That sends a
Mm.
message to your body that, hey, we're in a nutrient depleted situation. We're going to conserve fuel. And hair
Mm.
follicles are kind of the first sign or symptom, if you will, of the depletion of nutrients. So that's a
Oh.
very, very common thing that we see in the practice is shedding, especially today with the GLP-1s or the GLP-1 agonists like Ozempic and Manjaro and so forth.
Oh. Oh, that's interesting.
Mhm.
So that shedding is a side effect of some of those medications, is it?
Absolutely. Well, the medication is cutting down your caloric intake. It's slowing down your
Mm.
digestive system. It's impairing perhaps even absorption, and of course your appetite. That's the whole idea. And as you become
Mm.
caloric depleted, you're going to start to burn the fuel that you have on hand. The belly fat around your midsection or thighs or whatever, and that's all fine and good. But you're not going to have that fuel to really grow good hair. So very often a
Mm.
shedding, what we say a telogen effluvium, which is a sudden synchronized shed, can occur with that significant weight loss.
Ah.
Just like if you undergo general anesthesia or childbirth or things like that, you can have a
Mm.
telogen effluvium or sudden synchronized shed.
Oh gosh, honestly, it's so technical, I must say. Um, so coming back to this, circling back to menopause and hormonal fluctuations, I know that the hair follicles are, is it androgen sensitive? Is that am I using the right terminology there?
You are actually. Androgenetic alopecia is that term for female pattern hair loss. And so,
Mm.
what we know is that if we lower the DHT production in the body, and women don't have too much dihydrotestosterone, which is that metabolite of testosterone, but if we do treat patients with, for example, finasteride, who are postmenopausal, and this is an off-label treatment, it's not FDA approved for that. That's the footnote on there. About 50% of patients actually have some improvement, either a
Ah.
stabilization of their hair or some hair regrowth. So we do know that there is some androgen component. But again, if there's a sudden shift in the amount and quality of your hair, we definitely want to take a wide look at what's going on with your blood biomarkers, your hormone levels, how it's cycling over the day. So we may do saliva testing and so forth to really get to the bottom of it. And very often when we regulate hormones, we find that the hair growth improves.
Ah,
And this is very, very exciting and great. Now, remember also in menopause, if you have, let's say, low testosterone, a lot of physicians
mm,
might want to replace that for you
mm,
for all the great reasons, from sex drive to lean muscle mass and so forth,
mm.
and bone and so forth. Testosterone is the enemy of the hair follicle
Oh,
because it does
yes.
get converted into DHT. So a lot of women um, do notice that they have some accelerated hair loss when they start some testosterone replacement. And so, one
Ah,
of the things that we do in the practice, especially in the functional medicine division, is to replace hormones or optimize hormones in our female patients and male patients, but not harm the hair. So there's a plan for that, obviously.
yeah, yeah.
Um,
I mean, I that's so important. This sort of restoration of balance. So
mm,
taking supplementing with hormones is all very well, and I definitely have my HRT patch on as we speak.
okay.
But to take this holistic view is it's not just what is it doing to all the different parts of us, and if hair's a concern for you, then you may not have realized that that could have a bearing or an impact on the health of your hair.
No, and sometimes you don't realize until you've started that
Mm,
hormone replacement program that you're super sensitive to it,
mm,
and so it has to be
mm.
titrated back and
Yeah, yeah,
adjusted
yeah,
accordingly.
yeah, yeah.
And other therapies may need to be instituted to help protect the hair over time.
Mm,
Some of the things that we do, DNA analysis to look at certain different metabolic pathways that might impact hair, and
mm,
also tell us which treatments or therapies might be more important for you, more likely to get a good result. So we're not doing so much, testing and trying as we go along. We're
mm,
actually looking at the DNA and giving us a more precise or precision approach that's individualized for each and every patient,
mm,
and that's something that's very, very helpful, also for men and for women. These metabolic pathways, not just what medications to use, but also, for example, what vitamins, minerals, supplements, things like that
mm.
could also be helpful. It kind of, gives a little red flag that, oh, hey, by the way, look at this, look at that. And so it allows us to take a deeper dive in some places maybe that we wouldn't have thought about previously if we didn't have those genetic tests available.
Yeah, well, that really does allow for targeting of treatments, doesn't it? Undoubtedly.
Oh, absolutely. Just as a great example, a lot of people will pick up a bottle of over-the-counter minoxidil Rogaine or Regain wherever you are in the world, and they'll try it for a period of time, and then they'll say to themselves, "I don't know if this is working. It didn't work for me," and they toss it out. Right now, maybe they
Mm,
didn't use it properly, maybe they didn't use it
mm,
long enough. But even patients who are consistent and compliant and adherent to the regimen, some of them, maybe 30% of them, may not get a great result, and that has to do with a genetic component. Really, the enzymes in the scalp have to convert minoxidil into minoxidil sulfate for that to
mm,
work on the follicle to stimulate hair growth. And if you are very low in sulfotransferase activity, which is the name of the enzyme, then you may not be a great candidate for just the traditional over the counter minoxidil. And that might explain
mm.
why it didn't really work for you. And
Yeah,
so
yeah.
there are things that we can do to address that. So if Rogaine didn't work, Regain or Rogaine didn't work, over the counter minoxidil didn't work, don't despair. It's
Mm,
not minoxidil's fault, and it's not your fault. It could be your genetics. And we just have to
mm,
use a little bit more of a nuanced approach with different topicals or oral medications or other methods, from lasers to injectable treatments to
mm.
whatnot, um, to get those follicles to respond and grow a healthier, thicker hair.
So I suppose this is the question that I'm just not sure about. If you have this genetic propensity for hair loss, and that can be women as well as men, you're saying, then can we really do anything to stop that, or is
Well,
it just?
absolutely.
Oh, go on, tell me.
Yeah. I mean, this is like, we don't have to accept aging, right? We have to fight every day so we can, live a more a vital and fruitful life. But
Mm,
look, there's no miracle cure, right?
ah,
If there was, everybody would know it, everybody would be on
mm,
it. And so, just like other parts of your health and wellness, whether it's your skin, your muscles, your brain, it's a multi therapy approach to really
mm,
attack the problem. There are powerful therapeutic interventions. They gain more power as you combine them. They work synergistically. For example,
mm,
just as if, for example, we spoke about minoxidil. Minoxidil increases circulation, it stimulates the hair to grow thicker, longer, better, turns hair follicles on that are resting, it keeps them in the
Mm.
growing phase longer. So that might give you that longer
Yeah, 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 yeah.
bob or ponytail, perhaps. But if you use, for example, with minoxidil, if you use laser therapy with that, low level laser or photobiomodulation, those red light therapy devices, a good quality one,
Mm,
you'll impart new energy to the follicle for use to grow better hair. You'll increase circulation. And so it'll actually potentiate the effects of just the minoxidil alone. So
mm,
combining those therapies together, very, very important, for example, in many patients. But you want to be careful. Again, you want to get a
mm.
good quality topical. You want to get a good quality laser. You don't want to just buy something off of Amazon and think that that's going to work.
No. And working with an expert who knows what the heck they're doing is invariably going to be the thing that you should be doing. I was listening to you talk about the mitochondria in the hair cells, and
Mhm.
is it in the follicle, the cells of the
Sure.
follicle? Yeah, and I was hearing you talk about the fact that the laser kind of charges up those mitochondria, so that's what helps the follicle to be healthy and energetic and grow. Can you charge it any other way? Are there other ways that you could charge those batteries? Because I was thinking about exercise, because I'm always going to think about exercise. But do you know what I'm saying? Are there other ways that we can metabolically speak to these mitochondria in the hair follicles?
Well, I'm not really sure how you would exercise the hair follicle per se. I'll have to give that a little bit of thought. I'm envisioning envisioning Freddie the follicle doing push-ups, in your scalp, but no, or calisthenics or something. But
Okay.
I mean, look, years ago we didn't know how red
Mm,
light therapy worked, and a lot of
mm,
physicians were confused. Listen, they never taught me that in medical school over 30 years
mm.
ago. I mean, the
Yeah.
only thing I knew about light and energy was photosynthesis, and that was plant. What does that have to do with any kind of human, right? But
Yeah.
today we know, I mean, I've been taught by some amazing mentors like Dr.
Mm,
Michael Hamblin, the inventor, and he's a very prominent researcher on photomedicine who was at Harvard and MIT and so forth. How he figured out how does red light therapy affect the mitochondria. And so that's why we can say with great confidence today that absolutely what you said is right, that you're kind of charging up, you're making those mitochondria work better. And I think what we find is that as you grow better hair, it's easier to grow better hair because just like
mm,
with exercise,
yeah.
your follicles are more energetic.
Uh,
They may be feeling like they need to create more mitochondria, for example, to provide the energy. So I think sometimes a chicken or the egg.
mm,
Almost like, do we need more mitochondria? Yes. Are there less mitochondria in hair follicles that are weakening? Yes. Do we need those to work better? Yes. And when the follicle is healthy, you have more. So it's like
mm,
you need both things happening at the same time. And I think
yeah.
that's why this synergistic approach is the way to go.
Well,
Some of the things that
yeah,
we do,
that's
are
go on,
designed to
tell
really
me.
stimulate. Yeah, I was going to say some of the other things that we do directly stimulate the hair follicle, like growth
Oh,
factors and
okay.
peptides that we can
Right.
apply, without an injection, or
Mhm.
treatments like PRP, platelet-rich plasma, are other
Oh,
types of therapies that we do in the office to try to get the
mm.
hair follicles to grow thicker, better, and stronger too.
And that's an application that you place on top of the skin of the scalp, is it?
Yes, well, the first method, the use of growth factors and peptides, for example, those are applied through the skin using sonophoresis, which is a
Oh.
sound wave, if you will, kind
Mm,
of like ultrasonic sound waves. Same thing that you
mm.
would hear, for example, from your ultrasonic toothbrush or an ultrasonic jewelry cleaner. It actually disrupts the moisture barrier in the skin temporarily, and then you can push those growth factors and peptides
Ah.
right through the skin during an in-office treatment that's so relaxing, most patients fall asleep, as I do. And that kind of therapy has been very, very effective for our patients, although it does require you coming into the office in
Mm.
order to stimulate the hair in that way. It requires one session a month for 4 months. And that's called TED, transepidermal delivery. And we call it TED for your head for fun.
Well, and why not? So, and then there are injectables, aren't there, as well?
Correct. So, the world of regenerative medicine has been leaning on platelets or platelet-rich plasma for many, many years, and everyone from
Mm,
orthopedic surgeons to
mm,
dermatologists to dentistry, you name it, has
mm.
used platelet-rich plasma or platelets as a source of very powerful growth factors and peptides.
Ah,
These are growth factors and other molecules that are locked away inside our platelets, which are used to stimulate tissue regeneration and repair, and those can be harvested right out of your own blood at the time of the at the bedside at the
okay.
time of your
Uh-huh.
procedure, which takes less than an hour. It's processed in a very specific way to get a high concentration of platelets, and then
Mhm.
it's applied into the scalp if you're doing it correctly in a painless way. Some
Okay.
physicians didn't get that message that you should do it painlessly, but that's neither here nor there. One of my pet peeves is that people come in, they say, "Oh, I had PRP and it was the most painful thing I ever had."
Oh,
It should not be.
doesn't have to be. Mm.
No. So applying local anesthetic into the scalp requires some nuance and some technique. It's the same
Mm.
technique that we use to numb the scalp when we do a hair transplant. But using the
Mm.
platelets into the scalp provides a boost of hair growth, and you get a thicker, stronger, longer, healthier, maybe even better pigmented hair for some time. Not
Oh,
forever. You have to
no.
repeat it, but it works to do that.
Yeah, so these are procedures to boost the health of the follicles and give us, this longer, thicker hair. And so what I understand, however, is that once the follicle's gone, it's gone, and it's not coming back. Is that true?
Well, that's true. Once a follicle is miniaturized so far that it's creating such a small hair that it's not visible to the naked eye, it may only be 2 millimeters in length, it may be unpigmented. It's really beyond the point of no return. And that's
Mm,
not such a good place to be. That'll give you a bald
mm,
spot, obviously,
mhm.
in an area or dramatically depleted zone. And if
Right.
that's the case, whether it's at your hairline or a part in the frontal zone, perhaps, or even in the crown near the swirl, we have to use some degree of hair transplantation to move follicles from the good areas, the more permanent zones, into those areas where the follicles are dead and gone. And that can be done not only for the scalp, but it can also be done for the eyebrows and eyelashes or
What?
scars. If you've had a brow lift or a facelift, you can use hair transplantation to fix all of the above.
Right, book me in. I'm coming. Honestly, I really am coming actually. The eyebrows. My eyebrows. I mourn my eyebrows, honestly.
You're more than
I I no, no, I do. So sad for my eyebrows that I have them tattooed on, which, oh gosh, poor eyebrows. It sounds fickle to talk about it, but I've got hypothyroidism. I'm menopausal, and my eyebrows just decided to go on vacation and never come back. Uh, uh,
mm.
and it really does. As you can see from this treatment that I've had here, that it frames the face. Even as a glasses wearer, because you kind of think glasses might hide your eyebrows, but they don't. And so it makes such a difference to how you look and how you feel at the end of the day. So I wondered about eyebrows, I have to confess.
So eyebrow transplants are a very intricate procedure, but highly effective. And it can be for people like you have said with hormone imbalance, thyroid included for
Mm,
sure. Sometimes eyebrow loss happens with age. Sometimes it happens with
mm,
plucking, styling the eyebrows, over
yes.
styling can
Yeah, yeah,
sometimes
yeah.
cause the loss. And sometimes it's just genetic. It just fades
Mm.
and it needs to be replaced. But remember that eyebrow transplantation comes with scissors. And so the reason why is because the follicles on the back of your scalp are pre-programmed to grow much faster and much longer
Oh,
than your eyebrows previously. So you
I'm
don't
with
forget you do
you.
have to trim and groom them. Yeah,
Well, grooming's okay. I can live with grooming, I reckon. Yeah,
yeah,
so I
we
must
all
say,
do.
yeah. I was watching a video on your, well, I'm not sure where it was. I think it was on your YouTube channel, actually, of this procedure of hair transplantation, and oh my gosh, it was absolutely mesmerizing, I must say. I had no idea that you were using donor hair from the individual, and that you are doing exactly what it says, transplanting this hair into a zone where the hair is sparse or lost altogether. And oh my goodness, you must have such good eyesight, because it was that tiny, microscopic.
Well, I'm gonna show you my secret weapon.
Go on then.
These are my surgical loupes.
Oh,
They give me my bionic Superman vision
yeah.
that enables me
Okay.
to see the individual follicles. So yeah, hair transplant today is not pluggy because it uses the grafts are so small, they're less than a millimeter in diameter. They're very tiny.
Mm,
So we're using single follicle implants, for example, for the hairline or for the eyebrows, and then some larger groupings, 2 or 3 hairs per graft as we go further back. But they're still very, very tiny. Each incision could be less than a millimeter before they're placed with the graft. So it is a delicate process.
mm,
I would say it's a combination of technology. Yes, you have to be able to harvest the follicles, and we do that
mm,
today with a minimally invasive approach that may have been what you saw. So
mm,
no longer do we need to take a scalpel to the back of your head with stitches or staples and take a big swath
yeah.
of scalp out with hair.
Good.
We don't do it that way anymore. Modern methods are much less invasive, and that's what we've been doing exclusively for over 15 years.
Oh,
Now,
wow.
look, 25 years, 26 years ago, all of us were trained in the strip harvesting process, but we've abandoned that here. So we do that because minimally invasive hair transplants heal faster. In our hands, they grow beautifully. We don't have to worry about density or coverage or anything like that because we figured out how to get those grafts to stay alive and grow very robustly through this method of harvesting and storage and implantation all in the same day. So it's a
Mm,
symphony of detail. It's not a one
mm.
man job. It does take
Ah.
a team. Uh, some people say a village, but it does take a team um, to help me do the procedure and to efficiently create
Mm,
those beautiful hairlines for both men and women. And it's a labor of love. We do it every single day here at the practice, and we have a lot of fun. So it's the technology plus the artistry. You know, you don't want to travel to some
mm,
faraway country and end up with some straight across hairline. That's like getting
mm.
your teeth done with a row of chiclets or, tree bark or something. It's so obvious. So,
Yeah,
you
yeah.
want something that looks soft and natural, and that's what we provide, a natural looking hairline. That's the artistry that goes into the process. Or even the crown area. You have to go
Mm.
in the angles, appropriate orientation and position to get it to look great.
Oh, yes, not just all stuck up in one direction.
No, you can't. It's not gonna look good. No,
Oh
and the
gosh.
eyebrows especially, right? Eyebrows are very, very tiny areas.
Oh,
There's a
okay.
huge amount of
Yeah,
change
yeah.
of hair direction, strokes, if
Okay.
you will, if you can
Yeah,
imagine
yeah,
that.
yeah.
So
Yeah, yeah. Oh, wow. I mean, it was just amazing to watch that. And you showed how you draw it all on, and you agree with the client, the look that they're hoping
mhm,
for. And it was very subtle, the result. But I say subtle, what I mean is you would never have known that's what it was. Um,
correct.
but it was transformative for the individual, that look. And what's wrong with us wanting to look our best? Um, I mean, I don't think there's anything wrong in that. I'm not saying that, society's dictating we should look a certain way, and so we need to all go and get hair transplants to do that. But it's about the individual having the option, having choices. And and in a lot of instances, I'm sure the treatments that you offer it don't involve transplantation, and it is really just that holistic approach to health and wellness that benefits the hair, the follicles, but it would in turn benefit the whole of the body and the overall mental health, physical health. So my business is prevention is better than cure, and so if we can start looking after our hair, sooner rather than later, and be really um, sure that if we have got issues, there are people we can turn to for support and assistance, and not to just suffer in silence and feel bad about ourselves, because that does nobody any good, does it?
No, absolutely not. I mean, you want to live your life, but you want to have that freedom of choice, and that's what hair
Mm,
does. It's your
mm,
choice. To maintain muscle mass, to maintain your brain function, to maintain the look of your skin or your health of your teeth, and so
mm,
forth, and our metabolism. Some things we can see, and some things we can't.
mm,
But hair is an outward sign of our vitality and youth, and that's why I think it's so valuable to people who want it, if they
mm.
want to maintain it. And so, yes, having that freedom of choice is critical, and it's not society that's dictating it. It's your lizard brain back here, that's telling you should look good. Um, you know,
Yeah,
Again,
yeah.
evolutionarily to move the
Mm,
species forward into the future. But the point is that today we have the options of prevention, and nearly 2/3 of my patients are not in the practice for a hair transplant. They're undergoing the non-invasive therapeutic regimens that we design, whether it be medications or laser, non-invasive therapies, even supplementation,
mm,
addressing their fundamental health issues through functional medicine, and taking a very, very 360-degree approach to their situation. And it's exciting. Many of my patients may never ever need a hair transplant because they're coming in at an early stage. They understand that
mm.
they're at risk. We're doing their measurements, we're doing their tracking, and we're keeping their existing hair growing strong and putting them on the path for a great head of hair for the future. So it's fun. It's a fun practice to have, and I'm excited also for the future.
Mm. Yeah, what is in the future? Are you seeing any new developments that are looking interesting?
Well, look, one of the things I get asked about is a lot is, do we have hair follicle cloning? And so in the layperson's
Oh, yes,
meaning,
yeah.
can we duplicate a hair follicle or have an unlimited supply of hair follicles? And we're not quite there yet. I mean, there
Mm,
are some very, hundreds or not 1,000 clinics around the country or research facilities around the world, I should say, working on this. We don't have it yet, so it's not really ready for prime time. But one of the things that we do have that I think is very exciting is hair follicle stem cell banking. And hair follicle stem cell
oh,
banking is a relatively new technology that will help us get prepared for the eventuality, which I'm confident we will figure this out. Hair follicle neogenesis, or new hair follicles, or hair follicle
mm,
cloning, as some people like to say. And so
mm.
when I'm going to need hair follicle cloning, hopefully it's not for another decade or two. So I don't want to use my 70-year-old hair follicles to clone for a head of hair. I want my
Oh, yes.
53-year-old hair follicles to clone. And so that's why last year I banked my hair follicles.
Oh my, did you? Oh, that's
Yes.
amazing. Well, because I was thinking about people with alopecia, the idea that you are transplanting hair from other parts. I mean, if you haven't got any hair on your head at all, then that's not an option, is it?
Well, you're correct. Now, of course, we didn't spend a lot of time talking about autoimmune alopecia. Alopecia is
Ah,
just a general term for hair loss. So, just
okay.
like
Yeah.
androgenetic alopecia is the
Uh-huh.
male and female pattern that can often happen around menopause. And then you have traction alopecia, which is like from hair extensions or wigs or weaves pulling on the hair
Mm,
follicles, destroying them over time. You
mm.
can also have alopecia areata, which is an autoimmune condition. It could end up in little
Ah,
patches temporarily of loss
yes.
that
Yeah.
regrow, sometimes with therapy, sometimes without. And then, of course, alopecia totalis, which you're losing all of the
Mm.
hair. And that's what you just described. But actually, the follicles are still there. So if you take something that blocks the inflammation, right, that interrupts your immune system from attacking the follicle, actually the hair regrows. And we have that technology. So there
Oh,
are medications out there called Janus kinase inhibitors, so JAK inhibitors, tofacitinib, rofacitinib. There's a bunch of different ones. They can
oh, okay.
actually be used to regrow hair in patients with autoimmune hair loss. So it's been very, very popular.
Mm.
Um, for some patients today, though, if they're not candidates for hair transplant and they can't tolerate those medications, we have to turn to non-surgical hair replacement options like a cranial prosthesis, which is basically like a fancy medical wig that stays
Okay.
on for periods of time.
Ah, okay. Well, it sounds like you've got it covered when it comes to hair, is what I
Uh-oh,
will say.
I see what you did there.
Oh, do you know what? I didn't do that. It just happened, but I'm so quick.
Well,
It's
yeah.
yeah.
Well, the topic will keep growing on you, as you go.
Oh, now I see what you did there.
Yeah.
Well, Thank you so much for this engaging conversation. I'm really so excited to share this with our audience, and I hope that there are people who take heart from the fact that there are things we can do to support healthy hair. At any age, but sooner is better. If you feel like you've got a problem brewing, then take action and get some support. And we will, in the show notes, put all the information that you have been sharing with us, and make sure that you're there featured, Dr. Bauman, so that we know where to find you for advice and support. And I know you mentioned that your website is an absolute Aladdin's cave of information for people to come and explore and discover things that they can do for themselves, probably, as well as the things that you can do to help them. So we'll signpost them towards your website. It really, unless you've got anything further. Oh, I remember you mentioned something. You're going to speak at the Longevity Summit. What did you call it?
Well, we'll be at the Biohacking Conference in Dallas at the end of May, beginning of June. I'll be there with my team. We'll have the opportunity to meet with patients there and show them some different things like the TED treatment, the transepidermal delivery device. We will be demonstrating that there. I'll have with me my AI-powered microscope, so we can actually do some hair loss measurements and quantify exactly what's going on. So that's the beginning of the discussion of what's happening to my hair. And the other thing that we have as well is the ability to start banking those hair follicle stem cells for patients. So if you were interested in that, please come by, find us at the Biohacking Conference. It would be Dave Asprey's conference in Dallas at the end of May. And we can make arrangements to bank those hair follicle stem cells right there. It's a non-invasive procedure. We just have to pluck a number of hairs to get enough biologic material. And of course, it's verified by the tissue bank and all of that. So, and I will be presenting on how to improve your hair span. So in the world of longevity, everybody talks about health span, which is the time that we live and we're vital. I'm sure you've heard that. And so I'm very keen on improving everyone's health span as well as their hair span at the same time. So that's one of the things that we do.
I love that. That's so clever. Well, yeah, let's have here's to a hair span. I'll drink to that. My husband, I'm going to tell you this now. My husband's got a head of hair that you would be proud of. And clearly it's hereditary, and he's very lucky, and he's forever congratulating himself on his hair. But it would be, yeah, it would be I know, like you've got any choice, but it would be interesting to see with that microscope, because as you said, you can have what appears to be a good head of hair, and still over time, with the aging process, we are, that it's going to be getting more sparse over time. So,
well, that's definitely true. Scientifically,
not that I want to upset him or anything, but
yeah, well, let him know that he could lose 50% of his hair, and it will still look full to the naked eye. And so, and that's a very, very important number to know, because people can lose a lot of hair in the early stages of hair loss that they could have protected if they knew that they were at risk or had these evaluations and so forth. And I guess the last thing would be that if they can't come to see us at the Biohacking Conference or the office here in Boca Raton, Florida, South Florida, I do pop up once in a while in Manhattan and New York City several times a year for treatments and evaluations. But most importantly, about 50% of our patients start their journey through a virtual consultation or online consultation, and that can be initiated through the website as well. So we can do a video call, much like we're doing now with Philippa, and talk about your hair loss situation, look at your biomarkers or blood work, and get an idea of what's possible. Obviously, we can't do a detailed analysis of your scalp through the internet yet, although we're working on it. We can start the journey and figure out really what's required to help you keep your best head of hair growing well.
Okay, well, sounds like you've definitely got all the bases covered there, and so it only remains for me to say thank you so much for giving your time this afternoon for this conversation all about my favorite topic, hair, healthy bodies, healthy lives, healthy hair. It's all part of that picture of thriving, not surviving as we age. So thanks so much, Dr. Bauman. And so just really remember to check out the links, find out more in the show notes. And thank you so much for listening today. Follow the Moving Through Menopause podcast on Apple Podcasts, and do share this episode with a friend. Thank you so much. It's been wonderful to chat. I'll say cheerio for now. Bye for now.
Thank you, Philippa. It's been great. I really enjoyed it. And if any of your listeners have any questions, maybe we can circle back with them and give them some answers.
Oh, that would be awesome. Thanks so much. We'll make sure we organize that. Take care
My
for
pleasure.
now. Thank you.
Bye-bye
Bye
for now.
for now.